go down. So we have to understand that the various causes of back pain and the solutions, and that is going to be our aim. So first of all, I would like to say thanks to our friend Tiwari ji, the chief editor of Double Helical. This magazine is doing so well for last 10 years and perhaps conveying various very important messages for the society and for the medical personnel also. Thank you, Tiwari ji, for organizing and bringing out this magazine and this sort of webinar, which are very much, which will become part of the YouTube. So for today, topic is back pain. And when we talk about back pain, uh, I will be interacting with some of the eminent speakers. And our first speaker is Dr. Chabra. Is Dr. Chabra there?
Dr. Akshara will join later soon, very soon. So it is better to start Dr. Mukherjee.
All right. So, Dr. Mukherjee, can you
Yes,
hear us?
yes, I can hear.
Okay. Dr.
So I,
Mukherjee is just a minute. Dr. Mukherjee.
yes, please.
Dr. Mukherjee is a very eminent neurosurgeon, having experience of 25 to 30 years, and uh, he is at present the senior consultant of neurosurgery with Kailash Hospital in Noida. And before that, he has experienced in one of the leading centers all over it, perhaps in Chennai and Calcutta. And Dr. Mukherjee, we would like to hear from you as a neurosurgeon. There are many patients who are coming to you, but as a neurosurgeon, what are the etiological factors you are facing and what sorts of solutions you are offering to them?
Yes, good morning, everybody. Yes, there are many patients with a low back ache is presenting to me every day, and mostly elderly patients. Uh, but yes, younger generations are also there. So I will say that 80% of the 80% of the patients presents with low backache in some sort of the other. And coming to the etiology, most common what I see is degenerative disease after 40, 45 years of age. Then comes trauma, infection etiology, and other different discal infection, different discal problem. But the commonest problem what I see is a degenerative disease in terms of disc degeneration, in terms of listhesis and all other things. And about presentations, mostly the patient present with a low back ache, and sometimes with a radiation pain in the lower limbs, associated with numbness and with paresthesia, and in more advanced cases probably bladder bowel dysfunctions or saddle anesthesia. These are the common mode of presentations, or even sometimes there are neurological deficits like foot drop, weakness, difficulty in walking. These are the different mode of presentations what I see in all these patients.
Right. So whenever the patient of back pain comes to you and you subject the patient for various battery of tests.
Yes.
And so my question is that which are the most commonly undertaken tests?
The most important part of this when a patient comes is a proper history taking.
Hmm.
Uh, to assess the etiological, assess the etiology. When did it start? How did it start? Duration of pain, whether it is chronic, whether it is acute, his occupations, type of work, like people with a prolonged sitting, bad posture, they undergo this kind of pain, which is very very common. Then comes history of trauma, all these things. So clinical history taking is very important. Then comes a neurological examination, whether these patients having a neurological deficits in terms of power, in terms of sensation, SLR, straight leg raising test. So all these things are
So,
then
yes, so,
judged.
after the entire clinical examination,
Clinical,
can
yes,
you,
clinical examination.
yes,
So after
can you
history
give
taking,
me three most common conditions
yes.
which you normally get?
Normally, the most common condition is degenerative. Degenerative disease is the most common things in the terms of arthritis, disc prolapse. This is the most common cause, and this is followed by trauma. And third, I will say it is infection. The tuberculosis is becoming extremely common. Is becoming common. I won't say extremely common. It is becoming a common cause, especially in our country and especially in my setup.
So, degenerative, trauma, and then infection. Very
Yes.
important. And can you give me just a rough idea that out of 100 patients you see, how many patients are being advised for surgical intervention by yourself?
About out of 100 patient, I will say 20 to 30% I will advise surgery.
Okay, because of course, every patient, I'm talking from patient point of view, they are always afraid of surgery.
Yes, they are.
It's a but natural psychology. Even if it is me, I will also think twice.
Yes,
But at the
certainly.
same time, if it has to be undertaken, yes, why not? Right?
Yes, yes.
So, what do you think is the success rate of the surgery, and what is the satisfaction level of surgery?
The first thing what you said is very, very correct. Everybody is extremely apprehensive about surgery. The first question they said that, will I be all right? Will I be bedridden after the surgery? New spine surgery is not successful, according to many of them. That what we heard and what the relatives, what our friends told us, that spine surgery is never successful, never. Sometimes they use the word never successful. I will be bedridden throughout my life. Is it true? So from that point, I do try to convince them, yes, surgery is necessary. But on the contrary, when the patient is having uh, profound neurological deficit, uh, it is easy for me to convince them, because they are already having problem. Like if there is a bladder bowel dysfunction and all this deficit, then it is relatively easy for me to convince them about surgery. Coming to the success rate, I will say 80 to 90% there is success rate, even with a surgery and with the fusion, I mean with the implants, uh, it is successful. So the success rate is becoming higher these days. Rather, when I was a student, I was a PG, what I used to see and what I see these days, the success rate has enormously gone high,
Thank
improved.
you. Thank you, Dr. Mukherjee. Perhaps I'll come back to you again with
Yes,
some
please.
more questions. And now I will like to invite my friend. Hello, Dr. Chabra. How are you? A person who had responsible for bringing up Indian Spinal Injury Center in Vasant's capital city of India, and he is known for his skill for looking after spine. I myself remember that many of the patients who contacted me that can we go and meet Dr. Chabra. Dr. Chabra, now he is with senior consultant with the hospital, which is called Balaji Action Medical, very old institute in west part of the Delhi. Dr. Chabda, can you hear me? Dr.
Yes, sir.
Chabda?
Yeah, morning, sir. Sorry, I was muted. Can hear you very well, sir. Apologies
Great.
for joining a
So,
bit late. Right,
uh,
sir.
with your vast experience of dealing with back pain,
Right, sir.
and I remember that your approach is more or less a approach which may call uh, multidisciplinary approach.
Right, sir.
We'd like to hear from you that what had been your experience regarding back pain at normally what age of the patient they start coming to you till what? Right from younger one to the oldest one. This is my first question.
Um, Thank you, sir.
And
Yes, yes, sir.
and the causative factor.
Yeah, uh, would want to say that in the modern era, back pain has been like a pandemic by itself. It was an epidemic before, and maybe the COVID pandemic transformed it into a pandemic also with more sedentary lifestyles because people were confined to home and from work from home where people would resort to non ergonomic conditions of work, like working from the bed. So it has become rampant. And in the spectrum of patients that I see them across the ages. Even children, the elderly, but it's more like a bimodal presentation. One is the young active age group. 25 to 40 years of age, and also the elderly patients who between 55 to 70 years of age. And the causative factors may differ between the two. By far, the most common cause of back pain in my practice is a mechanical back pain, which may not be degenerative, but because of strain of the muscles, ligaments, joints. So, what you may call as a lumbosacral strain or a thoracolumbar strain. So, most of them are mechanical back pain. And whenever we get a patient of back pain, our first intent is to try to rule out a sinister cause, whether there are any red flags in this patient or not. Most of them would not have any red flags with them. So we look for the nature of pain. If the pain is more on exertion, gets relieved by rest,
So,
this
Dr.
becomes,
Chavda,
yes, sir.
Before we proceed further,
Right,
you
sir.
said red flag,
Right,
right?
sir.
So
Right, sir.
red flag, we like to further define red flag.
That's what I'm coming to, sir. With these explanations, I'm trying to explain the red flags. So, if there is a pain which is not characteristic pain of mechanical pain, mechanical pain gets exacerbated by exertion and gets relieved by rest. But if there is a pain which gets exacerbated by rest, like morning stiffness, or if there's pain more at night, so this is a red flag for us, wherein we have to rule out more sinister causes like inflammatory pain, like tumors. If there is associated fever, we have to rule out an infection. If there is a neurological deficit, profound neurological deficit, then again we have to evaluate the patient and rule out other causes like infection, advanced degenerative changes like myelopathy or tumors, neoplastic causes. And one of the most important things in the history that we ask for is if there is any bladder bowel involvement. If the patient needs to strain for urine or there is incontinence, then we need to rule out other causes of bladder involvement, which may be common in the elderly age group, like prostrate in the male. like stress incontinence in elderly females. But we need to rule out, and one very simple test then which we do to rule out bladder bowel involvement due to pressure on the spine is perianal sensation and voluntary anal contraction, which all our team members and nurses are trained to evaluate, and this becomes the basic test before we start evaluating them further. So other red flags would be a history of, say, carcinoma before, neoplasia before, and also in the elderly, we need to be more cautious in evaluating properly because there can be sinister causes which may come in. Then there are also the yellow flags which we need to rule out because this is not as common in India but very common in the West, where if the back pain results from work, so they get workman's compensation, and many people would feign back pain due to this. But would want to mention that in India, very often chronic back pain needs to psychological stresses, which lowers their threshold to withstand pain, and the vicious cycle forms, and you need to rule out these yellow flags in all cases of chronic back pain. So if these red flags in the history are eliminated, then we and our findings suggest that it is a mechanical back pain, then we would manage them accordingly. And in my practice, I do not necessarily advise investigations to them unless the pain has been chronic. Then I would suggest that investigation could be done. And depending on the findings, one of the most common investigations in chronic back pain that we would advise is MRI of the spine, though I would not want to discount the importance of X-ray also, especially in a country like ours, where that can also give us very important insight into the cause of back pain. And then in a subgroup of patients who have morning stiffness, who have risk factors like early menopause, like diabetes, like a prolonged medication use like anti-epileptic, steroids, etc., we need to evaluate them for osteoporosis as well. And this also is a common factor, especially in the females, but would want to point out that it is a myth that osteoporosis is a disease of the female gender. Men are equally prone to osteoporosis, especially in our country, where some pilot studies have shown that in fact men may be more affected with osteoporosis than females per se. So this is the entire spectrum of spine gets involved when we talk about back pain, because that is the most common manifestation of any spine ailment. I would want to add that most of our patients respond to a good conservative treatment. Even if there may be some early signs of neurological deficit, etc., of course, we won't wait for the red flags for that. And in my practice, I would say, responding to the question that you had earlier put, hardly 3% of patients would need a surgery. Most others respond. Even we did a study of 401 patients of prolapsed intervertebral disc, and our need for surgery was only in 5.3% of the cases.
So, Dr. Chabra, I think you have given a very important point, mechanical causes of back pain, which perhaps takes away a big chunk of the etiological factor, and rest are degenerative or infections or any tumorous part, which our colleague, Dr. Mukherjee, as neurosurgeon, did mention. And obviously, when it is mechanical, perhaps we will be looking towards some sort of conservative management and may go for surgical intervention if it is must. I'll get back to you.
Right,
Now I
sir.
will proceed to my next speaker, and my next speaker is Dr. Jyotsna Agarwal, who had the background of anesthesia. She had been professor of anesthesia, and now she is totally dedicated towards the pain management, and especially in the field of, along with pain, regenerative medicine. So, Dr. Jyotsna, thank you very much for joining us. Of course, we have discussed some of the very important part of our discussion, the etiological factor, with two eminent expert from neurosurgery as well as from orthopedic. I'd like to ask you, what do you think, especially in our female patient, there are back pain is very common, and can you explain to us when, especially in postpartum stage, and do they get, even a young lady of 20, 25, 30, what do you think is the status of back pain, and how do we manage it?
Good morning, everyone. So regarding back pain in postpartum period, it's a very common complaint. Approximately more than 60% of females present with that after pregnancy they have developed back pain. If we go into the pathophysiology, basically it's related to the hormone thing also, because the relaxin hormone is secreted during pregnancy, which leads to relaxation of ligaments and joints and can also lead to the SI joint instability, which can present as back pain later. Moreover, there can be like bad posture during the pregnancy, exaggerated lumbar lordosis, which happens during the pregnancy, and the physical strain which can happen during as well as after the delivery when they carry the child. So bad posture and physical strain also have a very important role to play. In the factors which lead to back pain after pregnancy, is a very important factor is having back pain before pregnancy, prepartum. Before having pregnancy, also many girls are having back pain, and they have a very strong predisposition of having prolonged postpartum back pain. So back pain before as well as during pregnancy are strong predisposing factors. Then there can be associated comorbidities like hypothyroidism and gestational diabetes, which they may develop, which can also increase the back pain. And then there is a condition known as pregnancy and lactation associated osteoporosis. So in many patients, we see that they have come with a lot of osteoporosis, which is exaggerated during the pregnancy. These all causes together, along with the, as Dr. Chabra discussed, the biopsychosocial model. So all these contribute to exaggerated back pain. In younger females, there is one very important pathology which is known as fibromyalgia. So they can present with back pain along with chronic widespread pain. So they can have fatigue along with it, headaches, cognitive disorder, and waking up unfresh in the morning. So if we get these symptoms along with back pain and chronic widespread pain, means many areas of the body are having pain, and the patient is having these cognitive symptoms, we must rule out fibromyalgia, because the management of fibromyalgia is very different from managing a back pain case. So treatment of postpartum back pain would include physiotherapy, relaxation techniques, correct posture, and taking care of the comorbidities like hypothyroidism, diabetes, or osteoporosis, if it is there.
Sir, you're muted.
Sir, you're muted.
Sir, you're muted.
So you are unmuted, sir, Dr. Agarwal sir. Hello.
I apologize. So, Jyotsna, thank you very much for giving us the picture of postpartum back pain. But now I would like to ask you the next part of it, the post-menopausal back pain our Indian ladies are suffering. And do we understand that average Indian lady is perhaps not that active physically, and in exercises as compared to the entire world? Does it affect? And what is the common picture of postmenopausal back pain?
So, when elderly ladies, postmenopausal ladies, they come to us with back pain. So we also rule out all the conditions which can be related to aging, such as stenosis and then degenerative diseases, and muscle weakness, osteoporosis, which is developed, and they are more prone to falls and injuries and imbalances. They all contribute to back pain. In addition, they can have knee pain or knee osteoarthritis, which can lead to back pain because of the incorrect uh, posture during walking. Actually, the activity, yes, in many socioeconomic status, yes, the activity can be less as compared to others. Then there are some areas where they are less exposed to sun because of their normal dressing and costumes. So the exposure to sun and vitamin D deficiency is also a very important factor in this age group, which can lead to osteoporosis and back pains.
So,
Uh,
as a pain management physician, do you offer them some solution?
We always, as
Do
Dr.
you
Chhabra elaborated, the conservative management is the first step. So we try to take care of the comorbidities and the deficiencies which are there. As a general rule in our pain clinic, we always go for the investigations, which includes the CBC, the thyroid status, sugar profile, and the vitamin B12 and
आपका
vitamin
कनेक्शन
D
थोड़ा
levels.
वीक है
We
क्या?
check all those, and we always try to correct them before starting any definite. Hello?
Yes. Can you hear
Can,
me?
yes.
Your connectivity is poor.
Okay. Let me just check it.
उसको जरा ठीक करो. तिवारी जी,
Yeah, we are
आपको
okay.
लगता है कि उनकी कनेक्टिविटी पुअर है?
Yes, a little bit poor. So it is a better to chance to Dr. Harjeet, he is waiting.
Okay, Josna, I'll come back to you. And now I will proceed with our friend Dr. Harjeet. And Dr. Harjeet is a geriatric expert, Sitaram, and experience as geriatrician is very important. We'd like to share with us. As regard the geriatric population is concerned, I'm happy that now geriatric population in India is gradually increasing and increasing, and we presume that by the time it is 2050, perhaps our number of geriatric population will increase to approximately 19% or 20%, I'm not sure. And what do you think as a old age or as a geriatric population, what sort of back pain presentation you are getting and how do you manage it? Dr. Harjeet?
Yes, good morning, everyone. And I am seeing elder patients nowadays, and yes, we are seeing a demographic shift in the next 2 decades. Currently, we are a younger population as a Indians, but in just next 2 decades, our age group of more than 60 will be going to increase than the children's. So there will be a very rapid demographic shift, but yes, accordingly, we were not prepared for that, specifically when we come to the old age problems. And one of the major problem which we see is back pain with old age. And this back pain is actually in old age is, we can say, affecting all other chronic diseases, because if we want to manage diabetes, if we want to manage hypertension or any other chronic diseases, we ask them for a lifestyle modification, But the first and the foremost difficulty for lifestyle modification is because they are not able to be active so much because of the back pain. And this is not only causing problem to the chronic diseases, but even their posture get deranged, and there is balance disturbances are high, there is a chances of fall are high. So we are seeing that just a single problem, back pain, is affecting in a multiple way to the elders. And we have very recently one of the person who was previously coming to me for back pain. I was like motivating them to go for do physiotherapy, be active, strengthen your back. It is very important, but they are having an imbalance. We have a assessment method also, is a physical assessment by which we assess for the fall risk, for the balance parameters, even how they are performing their activities of daily living. And because everything was in a not in a good way, so that's why we are telling them to maintain their physical activity, to maintain balance. But ultimately, few days back he came after fall with the hip fracture. So this is causing a really big problem, and fall, we know it is always a dangerous thing. And in elders, as we all know, as the age proceeds, most common cause is degenerative. Without any doubt, there is degeneration. And degeneration, if there is degeneration at one place, like if they have an osteoarthritis of knee, the chances are high that they might also be having a degeneration in the spine. So a knee spine syndrome is also a presentation in older people. And apart from that, injuries, trauma because of the bad posture, sometime hurriedly doing something, so that can also result in uh, sprains or strain in the back, which can also be a reason. But most commonly, they are presenting with the degenerative diseases, and and once they have a back pain or a degenerative diseases, this is affecting all their other chronic diseases also. So,
Sir, you have unmuted, sir.
Right. Dr. Harjeet, from your point of view, obviously, as geriatrician, your plan of management is conservative.
yes, sir.
And of course, if needed, you will definitely like to send it to your surgical colleague. So, what is the most important component of your conservative treatment in
So
old age?
most, yes.
Do you
So
think
the most
dietetic factor is also playing an important role?
diet plays a role, sir. Specifically, diet, calories, and weight. Weight management is an important factor, because overweight is obviously one of the problem. Apart from being in a posture and balance, overweight is a problem. So diet management is an important factor, and we ask them to go for a physiotherapy, because that is the most accepted way for most of the elders, that they says that we are ready with the physical therapy that we can do. And but if we talk to them about the surgery or anything, though Chabra sir very clearly said that most of the patients don't even need surgery. So, and but physical therapy and diet management, these two things specifically, weight regulation, posture regulation. So we have a in our hospital we have planned a very different forms of physical therapy for how we can maintain the balance of elders, how we can increase their strength and even resistance and weight training. So in all these formats, we have made up specialized physical therapy in which most of the elders are comfortable with that, and we have seen a good results also. At least pain management is better, balance is better. So conservative management is important factors.
Yes, very important point which I always feel, being the part of the geriatric population or
Mm.
being the senior citizen, it's a question to all of you and especially to Dr. Chabra. You have been dealing with your specialty for decades together. And I feel all of you have done a very good job as regard the bone health is concerned. But that is looking after osteoporosis, doing the test, calcium supplement and all. But there comes the question that how much concentration you are giving to sarcopenia. Don't you think sarcopenia is a very important problem in our country, especially where in our villages and all, what is the status of diet, the muscle status? And Dr. Chabra will like to comment in 2 minutes your experience of sarcopenia.
Yes, sir, very rightfully mentioned, sarcopenia very often coexists with osteoporosis or osteomalacia. And without the multidisciplinary approach, as you had also mentioned before, we can't manage such patients well. So an equally important part in management of bone health would be looking into the muscle strength. And so it's not only the pharmacological management which is important. Equally important becomes general conditioning exercises to build up on the muscle mass, fall prevention, a good diet, as you had also illustrated too, and all these play a very important role. Of course, in osteoporosis management, other than this, calcium supplementation plays also a very important role. So very often, either people miss managing the cause behind the fracture and they just manage the fracture surgically or conservatively, and studies show that as much of 85% of people managed for a fracture do not get management for osteoporosis. But also very often people confuse osteoporosis and sarcopenia management with just pharmacological management, and that's not the case. You need to look into it comprehensively.
And
So
I
you're
was discussing with some of my radiological colleagues, and I was asking them, what do you think about is your experience of assessing the muscle bulk? And perhaps now they are looking into sarcopenic index, and especially sarcopenic index as compared to Western world, it has to be different within our own country. And my some of the colleagues told me they are working on it, and they are going to bring a better standard for that. But any comment of Dr. Mukherjee, your experience with sarcopenia and back pain, and involvement of your radiological colleague, Dr. Mukherjee?
He has unmuted.
ओके ओके नहीं वो शायद वो चले गए ओके डॉक्टर मुखर्जी कैन यू हियर मी
Okay, please go to next. Okay.
ओके डॉक्टर हरजीत
Yes, sir.
so what is your experience of sarcopenia in old age and
Sarcopenia is one of the most important factor, and muscle loss is very means it's an pertinent. We see lots of muscle loss in old age, but the important factor is that in old age, muscle has three functions. Obviously, muscle strength, muscle mass, and the muscle function. So when we come to the old age, gaining a mass is obviously very difficult, but we try to gain at least muscle function and strength. And, and for assessment of sarcopenia, we have two ways. There is a questionnaire, SARC-F questionnaire, which actually assess the sarcopenic strength. And apart from that, in our clinical practice, just a hand grip is also a very good way of seeing about the muscle strength. And if we do a hand grip strength by a dynamometer, that is a very good way of doing it, because there is a parameters given according to the age and according to the gender. But even if we ask the person to hold this, means hold my hand or just two fingers, press it, and by that way also we can assess a hand grip. And hand grip strength gives us a good indication about the muscle strength. And if the muscle strength is weak, then we can move towards muscle strengthening exercises, specifically resistance training, to increase muscle strength.
that's right so hand grip test
Hand grip test.
very important and
Yes.
perhaps Dr. Chabra, a quick comment from your side, hand grip test.
Sir, hand grip test is one of the most important tests that are used, but would also want to mention that there are other tests like chair stand test, timed up and go test, how much, what is the speed at which person can walk a short distance, walk back and sit down again. But one of the most important tests that we do for osteoporosis assessment like DEXA can also be used to assess sarcopenia. And bioimpedance analysis is coming in a big way to assess sarcopenia. But also, if the patient has gotten an MRI done, we can assess on the muscle mass through the MRI as well. So this is a rapidly evolving field on which a lot of focus is being given, very rightfully so. And as you have very rightfully pointed, sir, needs to be taken into consideration
Yes.
whenever we manage such patients.
I strongly feel that, especially amongst our own people, we find fatty liver of any kind, beginning, early, moderate, severe. And ultimately, there is definite relationship of fatty liver and changes and muscle changes. So I feel mm, uh, careful consideration of muscle bulk, and our diet is different. I wish we should have very high protein diet, etc., as compared to Western world. But in my opinion, it's a very important consideration. Now I'll come back to Dr. Mukherjee. Dr. Mukherjee,
Yes, sir.
yeah, I think you got disconnected in
Yes, I got
between.
disconnected. There was some power failure and failure of my backup also.
No,
So I was
no.
disconnected for a while.
So I think after discussing with you and Dr. Chabra, and when you said that in your practice, a good number of cases, but as a neurosurgeon, you are getting advanced cases where the status of degeneration or the infection or the tumor, etc., or trauma, and you are getting perhaps more of surgical cases, especially in tertiary care practice where you get the
Yes.
referred cases, right?
Yes, that's right.
What do
Yes.
you think the latest advancement of surgery, which are coming up, especially in robotic and all, do you think, irrespective you are doing it or not, do you think it will bring a better precision to the outcome, or what had been, what do you feel about it?
Yes, certainly. There is, in the last few years, there is a tremendous advancement in surgical technique, and especially in terms of monitoring and navigation. So today, almost all the patients, I am operating using neuromonitoring, so that during the intraoperative monitoring of the nerves can be done. So I just come to know whether anything is nerves are safe or not, and how these patients will be. And other thing is neuro navigation. So it also helps precisely to plan the surgery and how much to proceed. uh, uh, previously Siam was we were using Siam. These days also we are using intraoperatively Siam. That is always extremely helpful. We take multiple images that also give some ideas of precision and uh, future management. Other thing is a robotic. There is a lot of advancements in robotic technique. We do not have this technique, but I have seen demonstrations. It gives precision how a surgery we can proceed, how the fixation is being done, and guidance how to proceed for a surgery, especially in terms of implants. So there is a lot of advancement in terms of these techniques of surgeries in the recent days.
Right. Thank you, Dr. Mukherjee. I wish that, of course, we have to bring more and more precision, and robotic and other procedures and technology you did mention are becoming perhaps the essential component.
Yes.
But of course, uh, robotic component is very costly for our average hospital in India. I'm talking pan India. And I really wish Dr. Chabra and all of you to think about that there has to be some sort of make in India product so that we can have the cheaper robotics and I mean, the benefit of precision should go to our bulk of population rather than to
I
only
think
limited.
Indian robots will be successful soon. People are trying.
I am fully aware that there are many trials are going on and some of them are already in process of getting approval. My request is that once they are approved, I will request all my colleagues who are into it to try and they must use the Indian robots so that
Yes, Indian
cost comes
navigation is
down.
very, very successful. Even what I am using is an Indian navigation. It is very successful. And I hope in the future, Indian robots will be successful also.
Dr. Chabra, your comment on it?
No, definitely, sir. One, uh, advancements have made the spine surgery safer. Won't say that it was not safe before, but there's always a scope for improvement. And this is also very important to explode the myth which is there in the society, which probably Dr. Saab also referred to before, that spine surgery is not safe. You need to convince the patient that if required, not going through a surgery has far more implications than going through a surgery, and it has become very safe by various methods as were talked about, which encompasses an entire spectrum. Better OT tables, which allow for less complications due to positioning, better neuromonitoring gadgets wherein you can have continuous neuromonitoring, multimodal neuromonitoring combining somatosensory evoked potentials and motor evoked potentials. Then better radiological evaluation on the table with 3D imaging facilities available, uh, with uh, more precision, whether it is 3D imaging navigation techniques or robotic 3D imaging navigation techniques, and with better implants, and also better visualization from microscopes. We are moving towards gradually exoscopes in this regard, and better other tools like the bone scalpel, which helps you in removing the bone more easily. So there's an entire spectrum of tools and gadgets which are available, which have improved the outcomes of spine surgery and of course made it very safe. Indian IIT Chennai is working on the robo, sir, and they had demonstrated it recently also in parallel to one of the conferences, and I'm sure that very soon this will be
Yes, I am
launched into
also
the
fully
market.
aware of the
Yes.
certain places where the efforts are going on.
Mm.
Okay, Dr. Josna, I'll back to you again. Now you tell us that as the pain management physician, my number one question is that whenever any patient is coming to Dr. Mukherjee or Dr. Chabra and main presentation is pain, pain and pain. In what way, if it is an early disease, in what way you can give relief to the patient, your specialty called pain management, which is coming up in a big way all over the world. In what way your intervention to look after the pain gives satisfaction to the patient, number one. And number two, and later on, uh, does it heal by of its own, or maybe later on the patient has to be undertaken for surgery? What had been your experience? And number two, as you have mentioned, you have a special interest in regenerative medicine, which is coming up in a big way all over the world. I have gone through many articles where the success stories and even the law of the land also approves it to a certain extent, if not 100%. Your experience of that. The two questions to you.
So whenever a patient comes to us for pain management, we always start with the holistic approach as discussed. We will go through the entire history and examination and go for the investigations and rule out all comorbidities and look after the biopsychosocial model also. So after doing all that and the conservative and medical management and physical therapy is required, then we suggest the patient whether he requires a surgery or whether he can be taken up for pain management modalities. So the red flags for us are the same like fever, weight loss, motor weakness, progressive sensory loss, and bladder bowel involvement. In those cases, we never do any pain management technique and we refer the patient for a surgical opinion. For pain management techniques, we have got techniques which relieve the pain, such as radiofrequency ablation. For facets, we can do medial branch. For SI joint, we can do radiofrequency. Or we can go for therapies which heal and regenerate the degenerated tissues and which reduce the inflammation. So there comes the regenerative medicine. So in regenerative medicine, we have got simple techniques such as prolotherapy, which involves dextrose injection, or regenerative therapies which are derived from the patient's blood, such as platelet-rich plasma or hyperacute serum or growth factor concentrate. Or we can have bone marrow mesenchymal stem cells, or we can have adipose-derived mesenchymal stem cells. So all of these, they help in reducing pain and regenerating the tissues. So we can give this, for example, in facet arthropathy, we can inject the PRP or the bone marrow MSCs. In SI joint arthropathies, we can do that. Even these can be injected in epidural space. And if there is a systemic disease such as systemic arthritis or fibromyalgia, with which the patient has presented to us, so we can give these therapies systemically also. IV also these therapies can be given. Then there is a newer regenerative therapy known as GOLDIC, gold-induced cytokine, which is very promising in certain areas. There are studies that it has been used in lumbar canal stenosis as well, and the patient had good pain relief. Not the pathology was resolved, but the patient was symptomatically better. So all these areas, we can do the pain management by various modalities. And
Right. So, yes, you want to continue?
and if the patient is a candidate for surgery, so we always advise them that they should first consider surgery. We only go for pain management when the patient is a candidate for a pain management technique.
So this is very important. Whenever the patient comes with the initial symptom of pain, etc., I strongly feel that like any institution has got tumor board, the same way there should be some sort of board where our surgical interventionist and our pain management expert and other experts sit together, the radiological person, and then they should be able to take a combined call. Here is the patient for conservative management, with the patient for surgical intervention. Here are the borderline cases, and that will definitely bring a very balanced approach. You see, we are just thinking towards patient, and we want to do anything in the best interest of the patient. And here comes very important concept, which I am quite convinced that sometimes the integrative approach towards pain also works. Integrative means whenever there is any intervention from any, like suppose the therapy approved by Ayush Ministry, Panchkarma, etc., and any other therapy. In case there is some strength, of course, I always recommend that whatever we are patient is being referred for, that particular procedure should be approved by the law of land, number one, and of course, there should be enough evidences for not only them to be convinced, for us also to be convinced. So that becomes the integrative approach of such condition, especially they claim a lot in some sort of degenerative condition. Dr. Harjeet, what do you think any experience when we are talking about degenerative condition of old age and there have been some sort of consideration of integrative medicine? Dr. Harjeet? Harjeet?
Audible,
Yes, sir.
Doctor?
Yes, sir.
Yes.
Actually, I think I lost a connection, sir.
No, I was just thinking that in
Hello. Yes, sir.
degenerative
I'm
condition,
audible, sir.
yes, you are
Hello.
audible. My question was that in degenerative condition of old age,
Yes, sir.
our colleagues from Ayush, especially in Ayurveda, do have evidence-based medicine. Have you ever
Yes, sir.
thought of it, or uh, you have been told by your patients that we got benefit?
Yes, sir. Yes, sir. Nowadays, we are seeing means many patient comes to us, and actually one thing which is in a, like we can say, the mindset of our Indian people are also like that they have a very strong belief in Ayurveda, or they call it as Desi, and they call our treatments at
Are we the
Videsi.
definite
Yeah.
science? There is no
Yes.
doubt about that.
Ayurveda, yes. So they have a very strong belief in that, and they comes to us, and though reluctant to discuss, because they know that because I practice modern medicine, and that's why they are reluctant to discuss. But they says that we have learned this, but mostly they are into yoga practices and all this. So they have a special yoga instructors who are telling them to do special postures, and actually I think they call it as yoga special postures, but ultimately what they're doing is physical therapy or physiotherapy only. And that physiotherapy or physical therapy, which we also call it as yoga, so ultimately they are conservatively managing their pain. But yes, they are very much going into that
Harjeet?
things also, and they are getting relief also.
I mean, basically, whether it is physical therapy or yoga, yoga is a science which India has given to the entire
Yes,
globe
yes,
for hundred thousands of years. Let us
yes,
appreciate that. And
yes, sir.
we should try to adopt the best possible point out of that,
Yes, yes,
right? So, in my
yes,
opinion, the best, we have to be together and pick up their best, and they should pick up our best. Of course, we have to practice in our own field. But there,
yes, sir.
again, I'm recommending a combined sort of discussion among experts from us and from them for in the best benefit of the patient.
Yes.
All right. So, any one comment from Dr. Chabra?
No, sir. There are various branches which initially people were skeptical about, but which have proven themselves with time that they are scientific also. Acupuncture and acupressure are one of them. And Ayurveda is coming forward in a big way, and there's a big focus on it, and it's a very deep branch. And I'm sure this will become an integral part of the multidisciplinary team approach very soon.
I think that is the strength of our country,
Right.
right?
Very
We
true, sir.
have so much is important. I mean, India is the base of Ayurveda. So we, the people of modern system of medicine, should look into it and try to see the best of them, right?
Very
And
true.
so that the outcome is more. Many times we find European and American countries and centers are bringing up, and then they say we have done so. No, I want India to do and come out with their latest protocol of treatment. Dr. Mukherjee, one point from your side.
Uh, yes, I would like to make one point about the Ayurveda medicines. Certainly, there is advancement, but I always recommend my patients to buy Ayurveda drugs from a proper center. Not it is randomly available these days. not to buy from any other centers.
I mean, if I try to see into Ayurveda, there
Yeah.
are three main intervention. One is surface intervention, other one is Panchkarma, and then third one is Ayurvedic pharmaceutical intervention.
Yes.
Our hesitation is as regards pharmaceutical intervention is concerned, they haven't, they claim that they have improved and their quality of medicine has improved. Yes, I fully agree that that is up to them to prescribe. We have nobody to prescribe Ayurvedic medicine. But
Yeah.
if at all it has to be prescribed, the quality of medicine and the component, etc., should be looked into carefully.
Yes, that's
Jyotsna,
what I want to emphasize. That
yes.
it should be, they should procure the medicine from a qualified Ayurveda doctor and proper medications. What is not available everywhere randomly in the market, they are causing complications.
Yes, I'm somewhat part of Ayurvedic ministry also
Okay.
sometimes, and this point has
Sorry
been
to
undertaken many
intervene.
times.
My sincere apology for intervene because we
Just a
have some
minute.
questions.
Yes, we are finishing. Josna, any last point from your side?
Integrated medicine and multidisciplinary approach is the way forward for all kinds of management, actually.
Yes, and as a pain physician, do you think I mean, your colleagues and your specialists should be together with our surgical colleague
Yes,
right from the beginning?
that would be the best approach for the patient.
Harjeet, last point from you.
Yes, sir. Sir, obviously these are the age-old treatment methods in India. But as the famous saying, trust but verify. So verification is important. So we have a trust on that. But instead of just blindly supporting them, it is always better to verify. And whatever the best comes out of it, it definitely to be used for the patient care. Thank you, sir.
Well, let me tell you that your observation is absolutely correct. Trust, and there has to be evidences. I was not, when I visited All India Institute of Ayurveda, I realized that so much evidences has been created by their system. But the only thing, we never sit together. Right? So if I look into their computer, they have done many studies and still we say, do more, do more. I think we have to sit together with them and then perhaps we'll try to find out what is their strength. Hmm? Okay. Thank you very much, Tiwari ji. I will like to first, please, if there is any question.
Yeah, I have some questions. One question from Hyderabad. The name of that question raiser Neha Reddy, and this question goes to Dr. Chawda. Sir, could you tell me, is back pain heredity? If any parents have it, am I also at risk?
If I got you right, back pain, the most common causes, which are mechanical causes, can't be hereditary, only that we inherit unhealthy lifestyle, because the lifestyle which is there with the parents, the children tend to follow the same. But some form of inflammatory arthropathies have a hereditary component. And some of the sinister causes may have some hereditary component to them. So you need to be evaluated very carefully for any form of back pain which becomes chronic.
And one question from Amit Das from Lucknow. He is asking, when should someone consider surgery for back pain and what are the risks involved?
Broad question is here.
And I also wanted to Dr. Mukherjee and Dr. Chawda both comment on it.
Dr. Mukherjee?
Yes. About I think what I understand, your question is about when to operate in a back problem. Am I correct?
Yeah.
Yes. I think you have already answered it, and that we would like to rule out, and if the Please go ahead. Let you answer.
Okay, not all the low back patients we are advising surgery, but most of the time we try for conservative management. But as Dr. Chabra said, there are some red flags in many cases. They surgery should be considered for them. Like if there is a compression, if there is a compression on neural structures, and patient is having deficit for it, it has to be that patient should be operated, or there is some kind, or there is a trauma, and again there is a neurological deficit, or there is spinal instability. This patient should be operated, and certainly if there is a tumor, that has to be operated. So surgical indications are always there and should be performed.
I would just summarize that by saying two main indications for surgery would be failure of a proper conservative treatment and presence of red flags. So these would be indications for surgery. And when required, surgery is absolutely safe.
And Dr. Jyotsna, could you tell me what are the lifestyles like factors like diet, weight, and stress contribute to back pain? Could you tell me?
Sorry, what are the lifestyle changes?
Factors like diet, over diet, stress contribute to back pain.
Yes, diet is extremely important because as we discussed about sarcopenia, so having good amount of protein in the diet, having vitamin D and vitamin B12 and calcium. So all these things, diet plays a very important role in back pain, in the pathogenesis as well as in the management. And in the physical activity, stretching activities and building up muscles and weight bearing activities are very important so that the muscle strength is there. When muscles are good, the joints remain better. And that is why lifestyle, stretching, as physical activity as well as diet, they all are extremely important along with the psychosocial factors.
And Doctor, this question goes to Dr. Harjit Bhati. Doctor Sahab, can you tell me how can people who sit for a long hours like IT professionals prevent back pain? Should I repeat? How can people who sit for a long hours like IT professional and others prevent back pain?
Yes, sir. It is an important factor. The first important thing is that to maintain a posture, have a comfortable seat, and maintain a posture is very important. And if possible, it is better to do some stretching in between, or getting up from chair after maybe 45 half an hour to 45 minute. Then they can change some posture, stretch themselves, and most importantly, it is better to maintain a good lifestyle apart from being in a professional your professional activities. Like if you have to sit prolonged on a chair, it is always better to have half an hour to 45 minutes of workout and strengthening the muscles and maintaining a good bone and muscle health. uh, if you are otherwise healthy, maintaining a healthy lifestyle and having a comfortable sitting position and maintaining an upright posture, that is, I think it will be sufficient and will work.
Sir, this is last question goes to Dr. Chabra. Sir, could you tell us how can we differentiate between regular back pain and something more serious than slip disc?
We talked about the red flag. So if in slip disc in particular, the pain will travel down the leg and the leg pain will be more than the back pain if the pain is because of a prolapsed disc. Sometimes prolapsed disc can also cause neurological deficit, so there could be weakness in the muscles. But again here, 1 to 2% of central disc bulge will have cauda equina syndrome. That is where people will have straining of urine or incontinence of urine, and this is a red flag which needs to be looked into.
Thanks a lot. Over to Dr. Agarwal.
Thank you. So we had a wonderful discussion in little more than 1 hour, and quite a good number of the questions were also raised. Back pain itself is such a problem, perhaps it cannot be dealt in 1 hour. It may require days together to talk about back pain in totality. But one thing is definite, that now with the newer advances and experts coming in, we have to, in a combined manner, give a particular approach to back pain, which I feel is in the best interest of the patient. A discussion amongst all of you is very important, and with our radiologist colleague also, which are very important component, and other practices like chiro practitioners in Western world and all, what is their strength, and our physiotherapy colleagues. So they should also be the part of discussion. They also perhaps whenever I interact with them, but of course, person like Dr. Chabra is there, who is perhaps monitoring and guiding them a lot. Thank you very much, my all speakers, Dr. Chabra, Dr. Mukherjee, Dr. Josna, Dr. Harjeet, for a valuable contribution. Tiwari ji, as usual, you are the boss
Or
who
you are
manages.
mentor of all of us. So really,
Please
thank you a
keep
lot
good.
for joining our webinar, and we will keep it continue, provided you support us to continue, join and speak more and more. Thank you very much.
Thank
Thank
you.
you to all. Thank
Bye
you.
for now. सॉरी जी देर हो गई थी